Bismillahirrahmanirrahim. Assalamu alaikum. My name is Afsara Badar. Currently, I'm working as a lecturer at the University of Lahore in the Department of Rehabilitation Sciences. Also, I'm working as a clinical audiologist in the University of Lahore Teaching Hospital. I have done my graduation in audiology from the King Edward Medical University. Today, I will discuss the topic of immittance audiometry. These are the learning objectives. Students will be able to learn that what is immittance audiometry, difference between immittance and impedance audiometry, and the procedure of tympanometry, that how the tympanometry can be performed. Also the classification of tympanograms and the application of immittance audiometry. What is immittance? Immittance is based on the admittance and impedance. Admittance is the ease of flow of energy, and impedance is the opposition to the flow of energy. Immittance audiometry is basically based on the procedures, that is tympanometry and acoustic reflex threshold. Acoustic immittance is measurement of energy or air pressure flow, which involves the ear canal, eardrum, ossicular chain, stapedius muscle, cochlea, cranial, 7th nerve and 8th, and the brainstem. Some of the components of the impedance are mass, stiffness, and frictional resistance. Unit of the admittance is the ohm. It means that ohms is the unit which can be stated as admittance, and the compliance is the ease in the flow of energy. It is the inverse of stiffness. Compliance or static admittance measured in cubic centimeter. Both are basically inversely proportional to each other. If one will increase, other will automatically be decreased. Some of the functions of immittance audiometry is the detection of middle ear pathology, functional defects of auditory pathway. It can differentiate cochlear from retrocochlear pathology and estimate sensitivity of the hearing loss. Also, it can provide diagnostic information regarding auditory neuropathy, facial nerve lesions, otosclerosis, and the brainstem disorders. Now we will discuss the principle that when a known quantity of acoustic energy is delivered to the ear canal, two phenomena can occur. Some of the energy is transferred and some of the energy will be reflected. The reflected energy will be based on the impedance of the immittance audiometry. If the impedance will be increased, then the reflected energy will be automatically increased. These are the instrumentations: prop tip, prop tone, oscillator, loudspeaker, monitor microphone, pressure pump and manometer, system analyzer, and oscillator reflex oscillator. This is the diagram. Basic immittance measures static compliance, acoustic reflex threshold, and acoustic reflex threshold decay. Now, tympanometry is an objective test which can be used to check the middle ear function. It provides information about the status of middle ear cleft, integrity, and the mobility of the eardrum and ossicular chain. Procedure: first of all, patient should be diagnosed with the otoscopic examination, and then you have to give instructions to the patients regarding the tympanometry, that it will not give any harm to the patient, and prop tip should be airtight to the respected ear. Then resulting tympanometric pattern can be recorded and classified. Tympanogram is the graphic display of the eardrum mobility. It can be plotted by introducing positive pressure plus 200 decapascal to the prop tip, and then reducing to the negative pressure minus 200 to minus 300 decapascal. There are some types of the tympanograms: type A, type B, and type C. Normal compliance value ranges from 0.4 to 1.5 cubic centimeter per milliliter in adults, and in children 0.2 to 0.9 cubic centimeter per milliliter. It varies from books to books and from articles to article. Like some of the articles can give you information that its value is 0.3 to 1.5, and some of the article will give you information that its value is 0.4 to 1.5. This is the graphical explanation of the tympanogram A. Compliance is normal, its pressure is normal, and its admittance is normal. Type A can be further classified as type AS and type AD. This is the graphical explanation of the type AD, in which compliance will be increased, and you can see the type AD in the oscillator discontinuity. Type AS, its peak pressure is plus 50 decapascal, but its compliance is less, and it is seen in the oscillator and oscillator stapes fixation. This is the graphical explanation of the type AS. Type B is further classified into type B perforation and type B oscillator otitis media. Type B perforation, in which compliance will be increased, and type B otitis media, in which compliance will be decreased. This is the graphical explanation of the type B tympanogram. Type C, it suggests eustachian tube dysfunctions. As you can see that type C has negative pressure, and which is seen in the eustachian tube dysfunction. Tympanometer in the young. In 0 to 6 months, in infants, high frequency prop tip will be used, which is 1000 Hz or 600 Hz. But more than 6 to 9 months babies, you can use 1000 Hz. But if they fail, then you can repeat the test with 226 Hz. Basically, the learning outcomes of the lecture. Thank you.